What's the story? So as a doctor, I can't count the number of times that I've asked that to a medical student or a resident in training. And the reason for that is when we ask, what's the story, what we're really asking is for them to distill a large amount of information. So physical exam findings, lab values, clinical history, and to create a meaningful story that prompts appropriate action. As a head and neck surgeon, I also know that there are some words that convey impending catastrophe. These words sound like cannot ventilate. That means they can't get air and oxygen into a patient. Cannot intubate. They can't get a breathing tube in either. Those words are the story of someone that could die without help, and the story of someone that I'll do everything in my power to help save and to rewrite that story, but with a scalpel or other tool from my training instead of a pen. But stories are also very important in terms of how they make us feel about ourselves. So this is a picture of my daughter, and I think we can all agree she's beautiful and perfect. But I think that at the same time, we've all been on vacations, right? Maybe on the beach, and you look at yourself a couple of years after the vacation, you look at that picture and you say to yourself, wow, I looked really good then. But when you think back to when that picture was taken, you remember feeling self-loathing, right? You turn the phone around and you're like, ooh, was this really what I look like? Why does my face look so weird? And the question is, well, what's the difference between those two reactions? And the difference is the story that we're creating in our mind. And I often joke that talks like this one are also a good example of this. And when they ask me like, oh, how do you want us to introduce you? I was like, let's keep it really simple. Because we often have in medicine grand rounds lectures, and someone comes and they give an hour-long talk, but before that, someone introduces them and there's like a long list of all the amazing stuff that they've ever done. And for me, that type of well-intentioned praise actually creates profound anxiety. Because the story my mind starts telling me is, hey, do you remember that movie that everybody told you was incredible and you thought it was only marginally good, especially after all that praise? That's about to be you. And then my mind starts telling me a story of, hey, you're sweating a lot now, so today was also not a great day to wear the homemade deodorant. And then you're like, okay, this is not going how I thought that it would. And oftentimes, there's a drive to be perfect that's combined with the inner story that's going on in our mind. And there's a reason that phrases like Pinterest perfect and Instagram worthy exist. We're obviously only supposed to show ourselves when we're perfectly groomed and the lighting is perfect as well. And the problem with that is, especially I think for those of us in medicine, that we spend so much time training to focus on the stories of others that we then omit or intentionally don't include things into our own stories that are critical not only to our own humanity and happiness, but to our ability to answer questions like, who am I and who am I becoming? And so I've been interested in how we relate to our experiences since early in my medical education. And I remember when I was a junior resident in my surgical training program, some of my female colleagues and I noticed that we internalized our experiences a little bit differently from some of our male colleagues. And for example, we could do an entire procedure skin to skin, meaning that we did everything from the first incision to the last stitch. And after that experience, we would mentally debrief and be like, oh, I should have done this better. My technical skills could have been better here. Residency's not going to last forever. Why can't I just be better now? But at the same time, we noticed that some of our male colleagues would be able to say things like, oh, nailed it, did it skin to skin, and that was kind of it for them. And we really wanted to have some sort of, explanation for why this was occurring. And at about this same time, the book Lean In came out. And one of the phrases and one of the sections in the book was about imposter syndrome. And if you're not familiar, that's basically a pervasive feeling of you're never good enough. It's just a matter of time until everybody realizes that you're a fraud. And that seemed to fit what we were feeling. So we did what anybody else in a similar situation would do, and we did some experimental designs to scientifically study this. And what we found is that imposter syndrome is actually very prevalent in medicine. And imposter syndrome makes me think about these 3 plants that live in my office. I got these 3 plants at the same time. My mom gave them to me 3 years ago. They all live together on my windowsill. I forget to water all of them for weeks on end. That windowsill is susceptible to temperature extremes, but they survive. But what do you notice about them? Right? One of them is doing markedly better than the other two. And it's something that's only known to the plants as to what's happening. And I feel that a lot of times imposter syndrome and all these other stories going on in our own mental backgrounds are only known to us, the person that's experiencing it. Our study found that 50% of female medical students experienced high levels of imposterism, and 25% of men. We also found that there were very high levels of imposterism in students who belonged to groups that were underrepresented in medicine. And to me, that reinforces statements like what Marian Wright Edelman said, is that it's hard to be what you can't see. And for those that aren't living that experience, it's hard for them to even know what it's like to be in those groups where you're not as represented or you don't feel where you belong. Because if that's not part of your story, you might not even know that that story exists. And this study really helped us to better understand and kind of give us language and normalize what we were experiencing. But I was still dissatisfied because it didn't really help me learn how to move through those experiences. Because at the end of the day, the question remained, well, what was the difference between the person that could move through that experience without any issues and those of us that were bullying ourselves about our perceived inadequacies? And the difference was the stories. The more that I thought about the stories that I generated on autopilot, the more damaging I realized that those were. So take, for example, that thought, why can't I just be better now? That thought assumes that there's some magic time or magic moment where you get that last skill, you level up, and now you ride happily into the sunset. But what that thought omits is the fact that, every bit of progress is essentially the compound effect of all the tedious, all the boring, all the ordinary choices that you've made up to that point. There is no magic moment where, the princess suddenly learns how to tame her dragons, right? The magic is in the mundane. And there's also something missing from that thought. That thought, omits the fact that there's a lot of struggle that can go on between the moment where you want to be better and the moment where suddenly you are. And for someone like me who trains in a surgical profession, a lot of times we can be highly self-critical, but we also want to portray this persona of, competence and excellence and resilience. And as a result, sometimes we omit things that maybe we shouldn't and that are critical to us. And there's my little dragon. And sometimes, what's not in the story is actually even more important than what is. And for me, I stopped my omission this past September of something that I thought I wasn't supposed to talk about or that I was supposed to hide. And the omission stopped when I had published something that I wrote in a publication called ENT Today, which is a magazine basically that goes out to all my head and neck surgery colleagues. And the story was about how when I was in my early 20s, I suffered a severe depression. And I described that experience like being in a black hole because it was so dark and insidious and heavy, and the gravity of it was just crushing me from the inside. And there were times when I couldn't eat. There were times when I felt so crushed that I wasn't sure my body would draw its next breath. I literally slept on my friend Megan's couch for 6 months because I was scared to be alone. And she sat with me on that couch, and she told me over and over and over again that one day I would be okay, and that she would keep telling me that until it was true. And one day, with support and therapy and medication, it was. But that's not the story of everybody. This is Lisa, and usually when I talk or write about Lisa, I change her name just out of respect for her and her family. But I talked to her mom and I said, this time I want to speak her name. I feel like it should be finally spoken, and her mom agreed. So when Lisa and I were in medical school, she died by suicide. And Lisa was the type of person that you would want to have as your doctor, because she was kind and she was just a good person. And she did not display any of the normal warning signs, because not everybody does. And, the ripples of her life and death continue to be felt by everybody that she touched, and a great many people that never knew her, especially those that received the life-saving gift of her organs. Because even in death, she was a healer first. And I don't know a single colleague of mine that has not known Elisa. And so while we can train, as much as we want to be excellent and resilient, being able to tell the stories of the pain that we've been through, or the things that, we've been through via others, is something that we haven't learned, but something that's very important. And so this is a picture of me and my little brother then and now. And the reason that I show these pictures is because I remember coming home from college my freshman year, and he was 9 years old at the time, and he offered to send me his allowance money every week when he realized, or he learned, that I was working my butt off in the dorms as a janitor for some extra money. And that was so meaningful to me that I remember everything about that day, everything about those moments. But generosity is just part of who he is, so he has absolutely no recollection of it. And what experiences like that have taught me is that while things happen around us and seemingly to us, what that is that's life giving us ingredients for the ink. But it's still up to us to decide how we want to wield the pen and write that story. And being able to change my perspective and being able to learn how to intentionally write different stories has been very important for me and my own well-being, especially since I work in a field where tragedy cannot always be avoided. So I've had patients where I know that something very not good is happening, and that an operation may not help. And in those situations, sometimes, they'll look at me and they'll say, "We understand too, but there's a chance and we want you to try." So I shake their hands, I shake the hands of their loved ones, I tell them I'll do everything that I can, that I'll take good care of them. They roll back to the operating room. It's my masked face that's the last that they see as the anesthesia enters their body, and finally their consciousness flickers and fades. And I'm still there hours later when it does turn out, in fact, that what they have is not survivable. And then I have to go out and talk to the family. And as I approach them in the waiting room, I see that they see me, and I know that in that moment, with every step that I take, I am both their greatest hope and their greatest fear in that moment. And I tell them, and they grasp my hands, and they thank me profusely, and I would prefer for them to punch me in the stomach. The sobs that they try to hold in come out, and they apologize profusely, and I feel my heart breaking with them in those moments. And finally, I take my leave, and I begin to walk back towards the operating room, and their wails, the echoes of their grief, follow me until the sliding glass doors of the operating room suites close behind me, and an abrupt silence descends. And when we have a death in medicine, we present it at what we call a morbidity and mortality conference, and that's supposed to be so that we can learn from our mistakes. Of course, this case was reviewed. My colleagues assured me I was not at fault, that despite my heroic efforts, her death was inevitable. And I knew that's not what I needed. What I needed was space for my silence, or for my sadness, so that it could be transformed eventually into something else. And I'll be forever sad about that patient, but what I try to remember is that there is strength and love in that story as well. So when we realized that her death was inevitable, I told the OR team that we had a new goal. And our goal was to make her look as beautiful as possible, because how she came out of the operating room would be her family's last memory of her. And so we closed her incision like we would for a plastic surgery case. We found a bright blue gown in which she didn't look quite so pale. And we pulled her arms through the sleeves so that her family wouldn't have to search for her hands to hold them one last time. And finally, I looked around and I asked, if this was our mother, is there anything else that we should do? And when the answer was silence and just a bowing of heads, then I knew that we could leave the operating room. And so this is the story that I try to rewrite when I revisit that experience in my mind, because it makes it not about me and my failure and my grief, but about how our team helped someone with an unsurvivable something to die with dignity, and how our acts in the operating room can be a final act of love and service, both for that patient as well as for their family. And so what I invite all of you today is to really explore what your inner storyteller is telling you. What are the words that you're using? And are these the same words that you would intentionally use, or is it just autopilot generated stuff that your brain is telling you? Because at the end of the day, the question is, what is it from these moments that you're having right now that you want to remember long term? Because if you're not intentionally writing those things, that's not what you're going to remember. And I also invite you to try on new ways of telling those stories to yourself until you find the ways that feel authentic and sincere to you. And do so with kindness and compassion for yourself, just like a little kid experimenting with being their own superhero. Because again, many years from now, what is it that you're going to want to remember from the experiences that have led up to this moment? And because our memories can be so tricky, I have maintained a daily journal since my daughter was born, because I recognize that if I don't remember it, she's certainly not going to. And then those things just disappear. And so certainly there are days when I would rather not make a particular entry, as with my patient who died. But no matter what happens to us, again, it's just the ingredients for the ink, and we still get to have an active say in how we want to write that message and how we want to eventually let those stories and those experiences transform us into who we want to be. Thank you.